Abortion is a deeply personal decision, and if you're here, you're probably looking for accurate, compassionate information on how misoprostol is used for abortion. This video is for educational purposes only. Please make sure to follow local laws and consult a licensed healthcare provider or a trusted organization for guidance. So, what exactly is misoprostol? It's a medication commonly used for medical abortion, mostly in early pregnancy, up to 12 weeks. Misoprostol works by softening the cervix and making the uterus contract, which helps expel the pregnancy tissue. Sometimes misoprostol is used on its own, and other times it's combined with another pill called MISOPROSTAL for better results. Here's how misoprostol works. First, it softens and opens the cervix. Then, it causes the uterus to contract, pushing out the contents. This is usually followed by bleeding and cramping, both of which are expected parts of the process. Now let's talk about the protocol often used when misoprostol is the only medication available. Again, always check with a healthcare provider or a reputable source like the World Health Organization. For pregnancies up to 12 weeks, the commonly suggested dose is 800 micrograms of misoprostol or 4 200 microgram tablets at once. You can take these under your tongue for 30 minutes without swallowing, insert them deep in the vagina, or place 2 pills in each cheek for half an hour. If needed, this dose can be repeated every 3 hours up to 3 times, so a maximum of 12 tablets. After taking misoprostol, most people start feeling cramping and bleeding within 1 to 4 hours. The bleeding is usually heavier than a regular period and may include clots or tissue. Cramping ranges from mild to very strong, and side effects like fever, chills, nausea, or diarrhea can happen but are usually temporary. How do you know if it worked? Bleeding and cramping are good signs that the process has started. After a week or 2, take a pregnancy test or have a follow-up visit to confirm the abortion is complete. But, and this is important, there are warning signs you shouldn't ignore. Seek immediate medical help if you're soaking more than 2 pads per hour for over 2 hours, have no bleeding at all after 24 hours, experience severe pain, run a high fever for more than a day, or notice foul-smelling discharge. Remember, medical abortion is just one option. Surgical abortion is another, performed by trained providers. Whatever you choose, know that support and trustworthy information are available. Take care of yourself and seek help if you need it.